This is a very old case I did maybe 13, 14 years ago. And you can tell that by the quality of the photos. So the patient came in and she had a denture she wasn't happy with, and she had missing lower back teeth and failing periodontal disease and failing restoration. So basically impossible to do implants for this lady because there's absolutely no bone in this area here and this area here. Now it is possible to grow bone across there, but it's just not very easy. And you need to explain to the patient just how difficult the process is before you go deciding to put them through it. So you can see perio, fractured teeth, these premolars are fractured and so on. One of the things that people particularly don't like about partial dentures is these things. So they'll tell you all sorts of problems with it. The reality is they hate the metal clasps. That's because they look ugly, and they always worry that they're going to wear the teeth, and obviously there is actually some caries going on there. So you can't always afford to do everything you want. So in this particular case, what I did was build up all her front teeth with composite resin, and then her back teeth were restored with crowns and then a precision denture. Now, for some reason, precision dentures just seem to be much more comfortable for patients than regular partial dentures. I think partly it's the better retention of I use a Breeden ball with a resilient attachment. So it's partly that, and it's partly the lack of metal showing. Obviously, with any sort of precision attachment, you need to do a crown as well, or two crowns to be precise. So there's a crown here and a crown here. Now the interesting thing is I haven't double abutted, so I didn't join this crown to this one yet. Many years later, everything's still going well. So there's two reasons for that. One is that the original tooth structure, if we go back and look at that, was quite robust in these two premolars. So that's the first thing. And the second thing, of course, is that we're biting against an upper denture. Dentures are just the most wonderful thing to have as the opposing occlusion. Now this picture, I will point out, is not just after it was finished, actually like 11 years later. So this is not an immediate post-op, it's a very long-term post-op, and we've relined the partial denture a couple times, but otherwise we've really done nothing much for this patient except some scaling. So just an alternative treatment plan using multiple modalities. So we use composite resin, precision dentures, and a new upper denture to restore her mouth. So not all rehabs are full mouth of crowns. Thanks very much for watching.